We now have the Dr. B.N. Tandon Memorial Oration. May I please request Dr. R.K. Dhiman, President INASL, and Dr. Ajay Duseja, Secretary General INASL, to please be the chairperson.
Thank you. Now we are moving towards Dr. B.N. Tandon oration. Dr. Badrinath Tandon was a renowned gastroenterologist and hepatologist celebrated for his contributions to the medical research and academia. Born on August 1931, he graduated from King George's Medical College, Lucknow, and furthered his training at Harvard Medical School and MIT. Dr. Tandon established the Department of Gastroenterology at All India Institute of Medical Sciences, New Delhi, and led it until 1991. He continued his medical practice at Pushpavati Singhania Research Institute and Metro Hospital, Noida. His research spanned bowel disease, the impact of malnutrition on digestive organs, and the identification of pyrrolizidine alkaloids in Junjunia seeds as a cause of veno-occlusive liver disease. He authored over 225 medical papers and served as the founder editor of the Tropical Gastroenterology. Dr. Tandon received numerous accolades, including the Shasha Kaba WHO Health Prize and the Padma Bhushan in 1986. He held key positions in various medical societies and contributed significantly to the understanding of the hepatitis E and C. He passed away on March 5, 2018, leaving a lasting impact on the gastroenterology and hepatology. Based on his significant contribution in the area of the liver diseases, INASL decided to start the oration on his name in the year 2024, and for the first orator was Professor Subrata Acharya and the second is Professor Yogesh Chawla. Thank you.
Good morning, everyone. It's my pleasant duty now to introduce the orator for Dr. B.N. Tandon Memorial Oration, and he's none other than my teacher, my mentor, Professor Yogesh Chawla. Dr. Chawla has been, as I said, my teacher, my mentor, and also teacher and mentor to many, many of us. He has been former head of the Department of Hepatology at PGI Chandigarh and also the former director of PGI Chandigarh. He's a Padma Shri awardee. He's also a BC Roy awardee, and he has had multiple ICMR awards as well. He has also been the former president of INASL, and in the research and publications, he has more than 550 publications with an H index of 65. Really have a very short CV for you, sir, but I know your work and your contribution to hepatology speaks volume by itself. And as said, this is the second B.N. Tandon Memorial Oration, and the topic you have very rightly chosen is the evolution of hepatology in India. So may I now request you to please come and give this oration. Thank you, sir.
Thank you very much, Dr. Dhiman, Dr. Ajay, and the INASL team to have given me a chance for this oration. I'm happy to give this oration because B.N. Tandon has been my mentor at All India Institute and a mentor for a lot of others in the country. But the first few slides would take you through the history of hepatology as told to us by Professor Adrian Rubin. And he said that liver was seen as a Paleolithic organ which had a large and heavy organ filled with blood, and this was the life source, and this is well described in the Stone Age. Then the liver surface anatomy was studied, and this was then known as hepatoscopy or hepatomancy. So there was work during that time. Then you have the Babylon clay model of sheep's liver in the British Museum. So there has been some work going on in liver. Internal hepatobiliary anatomy was described through the blood vessels by Aristotle in 384 to 322 BC, where they said that superior vena cava supplies the liver and the right and left portal veins supply the liver and the spleen, respectively. So you can well imagine liver has been studied since a number of years. It was Francis Glisson in 1677 who injected warm water colored with a little milk into the portal vein, which blanched the liver and appeared in the peripheral circulation. And that is how the Glisson's capsule came to be known. Uh, the microscopic anatomy was described by Dr. Rappaport in 1954. Way back in 1685, John Brown gave a remarkable account of liver appearing as cirrhotic, glandulous to the eye, and in Shakespeare's Twelfth Night, Sir Andrew Aguchek described a form of hepatic encephalopathy when he wrote that I am a great eater of beef and I believe that does give harm to my wit. This is all many, many years ago. But the actual, the start of hepatology started with Dr. Hans Popper in Chicago, where he conducted liver rounds. He was a pathologist way back in 1940s. But the actual credit of hepatology in the world goes to Dame Sheila Sherlock, who was the first American Association of Study of Liver Disease president. And she had started the liver biopsy rounds in Hammersmith Hospital, London, which got published in the Lancet 1943. She built a special unit of liver disease which worked on the pathophysiology of portal hypertension and hepatic encephalopathy in 1948 at the Royal Free Hospital, and the term hepatology came into existence in 1858. Not to forget that the world also had that time Professor Kunio Okuda from Chiba University actively working on the liver diseases, and Professor Roger Williams from King's College London. But now, since we are talking about evolution of hepatology in India, I consider Professor B.N. Tandon to be the greatest person who introduced hepatology in the field of gastroenterology to all of us. So, a big tribute to him. He's the one who started the term known as subacute hepatic failure. And we got very familiar with it, which probably now is akin to ACLF. But imagine way back in 1980s, we had been taught about subacute hepatic failure, and it was a very common association. Simultaneously, giants like Professor Madan Gopalan, he was working on Budd-Chiari syndrome in the south. Professor Guha Majumdar from IPGMER, he worked on non-cirrhotic portal fibrosis and arsenic. And H.G. Desai, all contemporaries, he was in KEM and he did a lot of work in hepatitis. But the start of hepatology happened in PGI as a unit first in 1977 by the then director P.N. Chutani, who was interested in liver. And it was in 1977 when Dr. D.V. Datta, who had gone to London and got trained with Dame Sheila Sherlock, he came back to PGI Chandigarh and he was inducted into the unit of hepatology. Professor B.N.S. Walia, the former director of PGI and who was here in this conference yesterday, he was instrumental in starting pediatric hepatology and building up Anil Dhawan, who is there with us. Finally, the Department of Hepatology was made in 1980 with Dr. D.V. Datta and Dr. Ibrahim Koshi joining him till 1983. And that was the time when hepatology started growing with a lot of work being done by both these legends. Dr. Dilavri and myself joined the department in 1983 in September and October, and we did a lot of work on the liver diseases. Some work which was initiated by both D.V. Datta and uh, Dr. Koshi, and we came out with wonderful publications of splenic pulse pressure measurement, spontaneous shunts, Budd-Chiari, non-cirrhotic portal fibrosis, extrahepatic portal venous obstruction, and we first started describing the entity portal biliopathy or pseudosclerosing cholangitis. A lot of work was being done in PGI on Indian childhood cirrhosis and parasitic diseases of the liver. But not to forget that three giants who were working that time were known figures in their own way. Dr. Kuru from Srinagar did a lot of work on HEV, you're all familiar with that. Started the study on the use of pair technique in hydrated of the liver, described the largest series of Echinococcus multilocularis, biliary ascariasis. These were entities which were never described earlier. Shiv Sareen simultaneously was working on acute and chronic liver failure, portal hypertension, and liver support. And Subrat worked on acute liver failure scores, Alfred score, HEV in pregnancy, and many other things pertaining to liver. Liver transplant surgeons also developed in the country. Professor Rela from Chennai, Avi Soy in Delhi, and Subhash Gupta from Delhi also became very active because more and more patients of end stage liver disease required liver transplantation. So there was a simultaneous growth of initially hepatology as a physical science, and then the surgeons also came up into the picture. Also, not to forget that some of the trainees from India, Patrick Kamath, Arun Sanyal, Raj Reddy, and Anil Dhawan, who were all trained in India, went abroad and made a name for themselves in the field of hepatology. And you have many, many excellent contributions from them, which is worth mentioning, and you will see a lot of their references. So in 1960, the Indian Society of Gastroenterology was formed, and during their meetings, liver discussions were limited to only half the days. And there was evidence of sibling rivalry between gastroenterology and hepatology in the later years. So the liver group formed the liver study group in 1979, and finally the INASL was born in 1992 from a very small number of hepatologists then. Now we have a total number of almost 1,500, as was said yesterday by Dr. Ajay Duseja. So we have these annual 3-day meetings and many midterms. There has been global collaboration with ASLD, EASL, and APASL, which means that the world has started recognizing hepatology from our country. World Hepatitis Day was first started by the hepatologists in the country, and just to name, Professor S.P. Singh was instrumental in starting this. And this was a big achievement. In order to promote hepatology, we used to have at All India Institute and PGI since the year 2000 a meeting which people used to look forward to, like current perspectives in liver diseases, which still carries on. This was only to orient the youngsters about hepatology, and probably it has contributed to such a large number of hepatologists getting interested in this field. So INASL has been very active over these years. They've had task forces on different liver diseases. They have made guidelines on different liver diseases, which are different from what you see from the American Association and the European Association. Since we were having a lot of publications, and these publications were going to the Indian Journal of Gastroenterology, the Journal of Clinical and Experimental Hepatology was started in March 2012. And you would be pleased to know that it has an impact factor currently of 3.2, which is very, very good for an Indian journal. We started training our residents at PGI Chandigarh with again a lot of effort. There was a lot of things pushed to get the DM gastroenterology organized in the PGI in 2008. So this was a 3 years fellowship, and over these years we have 37 qualified DM hepatologists from PGI. They undergo a rotational posting in gastroenterology, and we started the first liver ICU in a public sector and started liver transplants then. And currently, the department has come out with preventive hepatology, palliative hepatology, endohepatology, critical care hepatology, and the use of artificial intelligence as separate units, which certainly would expand over the years. But the expertise has been there in portal hypertension, cirrhosis, AIH, HCC, all the common diseases of the liver. After we had formed the DM hepatology course, then the Institute of Liver and Biliary Sciences was started in 2010, and it has excelled in the field of hepatology and is now known as the Institute of Excellence as a deemed university, which is amongst the 10 top medical institutes in India. DM started in 2010, and they have had 44 qualified hepatologists coming out from there. They have an advanced center for research, W Collaborative Clinical Center, Center for Advanced Clinical Training, and they have gone even further with 5 NMC approved degree courses of DM hepatology, pediatric hepatology, anesthesia, intervention radiology, and MCH, HPB surgery and liver transplant, and a number of PhD courses. They again are institute which is worth emulating in the country, and you talk of anything on liver, they have it there. They also have been the president and secretary general of APASL, and they also hold the School of Hepatology regularly by the APASL. Almost 8 institutes started Department of Hepatology and the DM program, with CMC Vellore in 2011, IPGMER, Madras Medical College, SRMC, SCB Cuttack, MGM Jaipur, and now SGPGI Lucknow. All India Institute started a 1 year fellowship. So there are almost 29 DM seats per year across India in 8 medical colleges. Some of the private hospitals also name hepatology amongst the headings, like Indian Institute of Liver and Digestive Diseases in Calcutta, which is now known as University of Human Sciences, Center of Liver and Biliary Sciences, Institute of Liver, Gastro and Pancreatobiliary Diseases in Gangaram, and you name Andrela Institute of Liver Diseases and Transplantation. So people are trying to promote hepatology, and this is one of the point where people have attracted the patients. So now we realize why hepatology should have been a separate specialty much earlier. There's a huge burden of liver disease in the country. Estimated deaths in 2015 was about liver related deaths 3.17% in India, and all cause cirrhosis, a huge number, liver cancer, huge number, acute hepatitis, and alcoholic hepatitis, huge numbers. So, liver diseases have fast spread as an epidemic, and this is all because of cultural and lifestyle transitions, sedentary habits, Western diet, alcohol, and chronic liver disease now is considered to be a public health priority. Transplantation also started in 1995 after the 1994 Thota Act, which was passed in the parliament. And almost the country needs 50,000 livers every year for end stage liver disease. Unfortunately, we've been able to reach about a figure of 3,000, but this is also the third largest number in the world after US and China. I would like to say here that there are about 655 transplant centers in the country. and 133 organ retrieval centers. So we all have to do more and more liver transplants, get trained, and the government and the National Academy have been constantly organizing organ donations and transplantation programs since 2023. So, what have we achieved in hepatology? The patient load has increased all over the country. Academics, we've been training our students and making them good hepatologists. But I would like to highlight some of the impactful research which has been done first in the country. In hepatitis C, epidemics of HEV was described in Kashmir and Delhi and many other cities. The serology dynamics of HEV was also studied for the first time in the country by one of our PhD students. HEV in pregnancy, you're all familiar, was a major problem. HCV elimination model in Punjab and India has been one of the excellent models which have to be shown to the world. Portal hypertension, spontaneous shunts, never described earlier. Portal biliopathy, never described except in India. Ectopic varices, huge series. Serene's gastric variceal classification, again something very unique, which has been produced by the Indian hepatologists. Non cirrhotic portal fibrosis, which was very actively studied in PGI, Delhi AIMS, and Calcutta. Budd-Chiari syndrome, acute and chronic liver failure, ARC prognostic scores, modest volume paracentesis as described by ILBS, Beato obliteration of spontaneous shunts in recurrent hepatic encephalopathy, minimal hepatic encephalopathy, and recompensation. These are some things which have been described from India for the first time and in huge numbers for the world to look at the results. In acute liver failure, you have the Alfred prognostic score, which is better than many other scores. Pregnancy, rat poison as a cause of liver failure. Parasitic diseases, I just mentioned. Improved BCLC classification of the intermediate stage was the first done in India. Lean MASL was first described in India. And now endohepatology has taken up in a big way, with experts even sitting here today on gastric variceal obliteration, liver biopsy, elastography, portal pressure measurement, and portal vein sampling. India is also in the forefront on artificial intelligence, and some publications on ACLF prognostic scores have come out from the country. Liver transplant, unique things, the largest number of living donor liver transplant in the world. LDLT in portal vein thrombosis, which was never described outside, has been described here. So also HBIG free transplant in HBV cirrhosis, reducing the cost of transplant, and the use of intragastric balloon for weight loss in patients awaiting liver transplant. And there may be many other novel ideas and novel thoughts produced by the Indian hepatologists over the years, which becomes impossible for me to name all of them. The hepatologists have also convinced the government to start the National Viral Hepatitis Control, and you're all familiar with that way back in 2018. And in 2021, the MASLD has been included in the National Non-Communicable Disease Program. So you see, there has been a gradual progress on the development of hepatology. I would like to congratulate Dr. Ajay for getting the INASL Recognition Award this year. Probably the second one after Shiv Sareen to have got this big honor. Congratulations, Ajay. Very, very big achievement. And lastly, I would say liver is a very important organ. It probably is more important than brain or the heart. And Sandeep, you would agree that most of the Bollywood songs have jigger in it. So hepatology is absolutely an important element of our hepatology thing. So I would, in the end, acknowledge all my seniors and colleagues and all the patients and the students who have helped in the development of hepatology in our country. And I hope this increasing number would further multiply so that more and more hepatologists doing good work would come out and make India even more popular in the field of hepatology. Thank you very much.
Uh, Thank you very much, sir, taking us through the evolution of hepatology in India. As I said earlier, it's customary not to have any questions or comments after the oration. We'll request you to please come in the center for the felicitation ceremony.
Thank you.